the Speaker of the House and the House Minority Leader, Nancy Pelosi, John Boehner, are actually talking very seriously about a permanent fix to the Medicare physician payment system. That is different. You know, everybody had assumed that there would be a 6-month patch, but now the focus has really been on a long-term care fix. You know, obviously we would like to see this addressed in the long term to take the unpredictability out of the situation, but it all gets down to the details. There has been a lot of talk about not paying for the total cost of it in an effort to really get past this hurdle that we've been dealing with. But even if we don't pay for the whole amount, there's going to be a piece of it that still will need to be paid for, and we always worry about hospital payments being in the mix as one of those pay-fors. If there is going to be a package, there are also things that we want to see put in the package. There are a host of rural provisions that expire on April 1st that we'd like to see extended. There are provisions like that would delay the implementation of the Medicaid dish cuts that we would like to see implemented. Right now, because of actions on previous patches, we were able to delay those cuts until 2017. We'd like to extend that delay. We'd like to see other provisions included, like a readmissions adjustment, a socioeconomic adjustment to the readmissions penalty program. We'd like to see an extension in the enforcement delay for 2 midnights. So while we have sort of our defensive agenda of preventing cuts, we do have our offensive agenda of trying to tack things on that need to happen as well. We're optimistic that it will be under serious discussion. We certainly would love to have that included in this first effort around the April 1st deadline. And again, it's bipartisan. It's something that we think will enjoy a lot of support. The thing is it was just recently introduced. So it's not like some of these other things that have been out there and have matured. So while it has bipartisan support and we think it's a solid recommendation, it's relatively new in terms of having been introduced as legislation. Nevertheless, we're confident it'll be in the mix. We're certainly going to try to get it on this first legislative train that's leaving the station as we speak. A potential crisis could be if the King-Burwell decision before the Supreme Court on subsidies being available through the federal exchange, if that's ruled as not being available, it could be a crisis for 8 million Americans that are currently getting insurance through those exchanges. Oral arguments on that were earlier in March, a final decision at the end of June. We worked with other national hospital associations to file an amicus brief in support of getting those subsidies through the federal exchanges. If the court rules the wrong way, we're going to have some serious issues in terms of making sure that those folks get coverage and they're not left out in the cold now and going forward. Well, there are some positive things in it, and when we talk about ACOs, there's really a regulation that's out there that deals with the existing generation of ACOs, and then there's the talk about the next generation of ACOs. The notion of having upfront attribution, so people know what the patients are that they're managing the care for, as opposed to doing all of it retrospectively, is something that they have indicated could be a part of the next generation of ACOs, which we think is a good idea. They've talked about waiving restrictions on the waiting requirements to get into skilled nursing care rather than having the 3-day requirement, waiving that for people that are in ACOs in this next generation. We think that's a good idea. Waiving the homebound requirement in terms of the eligibility for home health services so that it's more flexible to provide care to people that are in a home health setting, that might be something that is more flexible in the next generation of ACOs. We've heard talk that the next generation may have a better series of options relative to risk in terms of the upside for providers. While all of those issues we would hope would apply to the existing shared savings program, we're happy to hear those be in a part of the discussion relative to the next generation as well.